Hip displacement in children with cerebral palsy. Cerebral palsy, or CP, is a group of disorders which affect the development of movement and posture. Children with CP often have other musculoskeletal conditions as well. Notably, hip displacement, which occurs in about 1 in 3 children with CP. It is common for hip displacement to present at a young age, but can continue to progress until or after they stop growing. In a healthy hip, the ball and socket fit together snugly. In children with CP, lack of weight bearing and abnormal muscle forces may result in the ball moving out of the socket over time. When the ball is partially uncovered from the socket, this is called hip displacement. When the ball is completely out from under the socket, this is called a dislocated hip. The risk of hip displacement in children with CP is related to a child's mobility. Children with severe cases of CP, who are less mobile and less likely to put weight on their hip joint, are much more likely to experience hip displacement, occurring in up to 90% of these kids. With increasing hip displacement and dislocation, children may experience pain, decreased range of motion in the hip, poor sitting, standing, or walking tolerance, disrupted sleep, and difficulty with personal care. Degenerative arthritis may develop if the cartilage covering the femoral head deteriorates. Treatment options depend on when hip displacement is diagnosed. The child may be treated with various surgical procedures, including lengthening of the adductor muscles, or varus derotation osteotomy, with or without pelvic osteotomy. With increasing displacement, surgery is more complex, and the chances of complications increase. In cases of severe displacement, salvage surgeries, where the femoral head is removed or replaced, may be necessary as a last resort. In order to avoid the need for salvage procedures, hip surveillance is essential for children with CP. By identifying hip displacement early through regular clinical exams and X-rays, children and youth with hip displacement can be referred to a pediatric orthopedic surgeon at the appropriate time to decrease the risk of complications associated with hip displacement and prevent hip dislocation. In recent years, increased awareness of hip displacement in children with CP and the establishment of the Child Health BC Hip Surveillance Program has greatly reduced the number of salvage surgeries in BC. No child should suffer the burden of hip conditions. For more information on hip displacement in children with CP and your child's hip health, ask your doctor or visit imahippie.org.